Hello. In today's interview, we have with us Dr. B. Naveen Kumar, who has over 24 years of experience in the ENT department, who is currently practicing since the 19 years in Dr. Deen ENT Care Center. So, sir, today in this interview, we have few questions regarding our normal headaches and migraine, which our viewers have. So, we'll be clearing out some doubts and all.
Good morning. Yeah. In general, the term headache, patient comes to you when they experience pain or discomfort in the head. So till then they don't realize they have a head. Okay, in general. So headache is a term where a person or individual experiences pain in any part of the head. So that is defined as headache, right?
So could you please tell us more about the types of regular common headaches that we face in day-to-day life?
Yeah. Very often, when a individual comes to you with the complaint of headache, they themselves term a coin a term called migraine.
Yeah.
They tell I have a migraine, నాకు migraine ఉంది, मेरे को migraine है, ऐसा बोल देते. So one should understand what is migraine. Okay, so there are three broader classifications of or types of headaches,
Okay.
like migraine, then you have tension type headache, then third most commonest is cluster headache. So we come across this term called migraine,
Yeah.
which is a $1 billion business. I'm telling you, billion
Yeah.
dollar business across the globe.
Okay.
So patient with migraine can go to any doctor. It can be a physician, it can be a general practitioner, it can be a surgeon, it can
Okay.
be ENT, it can be ophthalmologist, it can be a psychologist. So many doctors come across this condition called migraine. Okay?
Okay.
So migraine usually, as per the textbook, it falls in the group of second decade or third decade
Okay.
of the age of an individual.
Okay.
Women are more affected than men
Okay.
in migraine. So they have a varied intensity of pain. It can be a slight throbbing. Throbbing means something pulsating in the head, and it is more of a one-sided headache. Okay? And there are two types of migraine.
Yeah.
Few individuals they get aura. Aura means they will know half an hour back or 1 hour back, they will know that they are going to have headache, and they'll have a tendency of nausea, and they may vomit. Okay, and more often they are not comfortable with light. So this situation is called photophobia.
Okay.
So suppose a person has gone to a wedding in the daylight, and they're getting exposed to sunlight or the lights within the party, and there is a lot of sound. So they got exposed to two types of phobia. Now one is photophobia, then the sound, it itself can invoke or
Headache.
stimulate migraine.
Okay.
Okay, so then they are not comfortable. The intensity of pain will increase. It may last to 4 hours to 72 hours, sometimes 72 hours. Okay, yeah, these are the main three types of headaches.
So that headache time varies for men and women. As you said, women experience it more, like the migraine pain.
Yeah.
So does men also get the same, when they get exposed to the lights and sound, as you said?
Yeah, intensity can be the same. It can be mild to maximum intensity, and they cannot tolerate it. It is so intense pain, they don't tolerate the pain. They have to go isolated.
Okay.
They want solitude for that time being. They don't talk. They become little aggressive at that particular point of view, and they go switch off the light. Okay, calm down themselves. They're more comfortable in a darker room and solitude.
Okay.
And there are certain drugs which help them. Anti-migrainous tablets, then analgesics, they help. They have, yeah. So this is how it has to be dealt.
Okay. So as you said, we have like around three types of headaches total.
Yeah.
The most common ones.
Yeah.
So, sir, how can we differentiate between them? Like the normal, regular headache, like which we keep on having like time to time, sometimes because of stress, maybe dehydration and all of that, and the migraine. Like because when we get headache, some people, as you said, they automatically thinks, ki, oh, I have migraine,
Yes.
aisa.
Yeah.
And then some things like, no, I have headache. Maybe it's because of like I'm not wearing my specs also, or maybe it's something happened to my eye or something that I'm getting headache. How can you differentiate?
Yeah. So as I told you,
Yeah.
migraine is a broader term.
Yeah.
Okay. So we need to understand whether that individual is having specifically migraine or it is other than a migraine.
Okay.
So we have to differentiate and examine the patient properly. Of course, symptoms may mimic, the same symptoms may mimic in few of the rhinology causes, in few of the nose conditions.
Okay.
Yeah, same symptoms can be there. Unilateral nose block, one-sided nose block also gives one-sided headache.
The side which like is blocked, we get headache on that side.
Exactly. So, as you asked, how to differentiate.
Huh.
So, first of all, the examination of the patient is important. And if you ask me, there are certain triggers. Triggers means stimulators which cause migraine, like alcohol,
Okay.
then chocolates, then beverages, then caffeine, coffee, tea, then sound, then
Light is there.
light, then in ladies it is oral contraceptives, then menstrual periods, then too much of travel, restlessness, okay, excess food intake. So these are all, trigger points for migraine.
Okay.
Yeah. So if you know this is going to cause me headache, then avoid the triggers.
Okay.
Alcohol, avoid. Chocolates, avoid. Caffeine, avoid. So
Like if I'm seeing like because of this I'm got a headache in the past, then I should avoid those things so that I don't get them again,
exactly,
or at least try to avoid as much as possible.
exactly.
Okay.
Yeah.
So as you said, ki like stress causes headache. Like that is normal. Like when we are in like high stress and all, it can be anything like about life, financial situations, work pressure, or anything that is going on. So the only stress causes us headache, or like dehydration, or like our bad routine life. Because like nowadays we don't even get time to maybe eat breakfast and we just rush to work because we are getting late. We don't eat on time. We don't drink water much on time and all. We don't sleep much also. Like our sleeping pattern nowadays has come down to maybe 4 or 5 hours, which is supposed to be like minimum 8 hours.
Yeah.
So does those things also causes us like any plays any role behind this?
Definitely, definitely. Sleep deprivation will have great impact on your day-to-day life. Suppose you need a sleep of 6 hours or 7 hours, and you are sleeping for 5 hours. There is a cut short of 2 hours. So where is the fuel to the body? So sleep is one of the biggest sources of energy. So if you ask me sources of energy, like you have asked me, if they have not taken enough diet,
Yeah.
number two, enough sleep or restlessness, too much of thinking, okay? So these are the sources of good energy, like food in time, adequate. Number two, good sleep. Number three, restful state of the mind. Restful state of the mind. These are the three major sources of energy. So if you are deprived of energy, definitely you will have headaches. So one more thing you have asked me, if subject has not taken enough food, so this is causing blood sugar fall. This is hypoglycemic headache.
Okay.
They'll have reeling sensation. They don't feel like full of life. They feel listless. There is no life in them. They feel dehydrated. They feel low. That also can give headache.
Like they force themselves to like walk in that moment and they get stressed at the end of the day. Again,
Exactly.
like it's coming to the same thing, ki they getting stressed and they're getting headache.
Yeah, it's a cycle.
Yeah.
It's a vicious cycle. So you have to break that cycle. So there are certain uh, um, disciplinary actions one should adapt for themselves in their day-to-day life to get rid of migraine. First, you know the cause of the headache.
Yeah.
One. Number two, go to a doctor,
Yeah.
examine yourself. You tell the symptoms
Yeah.
to the doctor, what is triggering the headache. Then number three, measures to uh, curtail the situation. And in future, you don't want headaches, then certain discipline they have to follow, like
Okay.
yoga, regular exercises, then jogging, whatever you feel comfortable. Like gym, you're comfortable at gym. Yeah, spend half an hour in gym.
Like whatever is giving us like some peace in mind.
Exactly. There is no hard and fast rule. You should go and do only meditation or yoga. If you're comfortable, early morning walk, please go. So things which makes you happy, things, the company which gives you good uh, energy, be in that company. So these are non-medical measures
Okay.
to curtail the migraine.
Okay.
Yeah.
So, as you mentioned a little while back about medicines, so what happens normally? Like I have also done in my life, and I have seen my relatives, my parents and aunties, uncle, everyone. Like whenever they get thoda bhi headache, they say two things. Firstly, I think my मेरा eyesight खराब हो गया है, I need specs. That is one thing. And the second, they are like कि if I'm having headache, I think I should go to the medical shop normal and get some normal medicines like
Calpol.
Serotonin. हाँ, Calpol is like it's like people don't even take rice that much as they take alcohol, and serotonin is there. So those kind of medicines.
Yeah.
So is it good to directly go to the store like over the counter medicine or the prescription ones? Like what's the difference?
It's not at all advisable to take migraine as anti-migraine tablets. I would recommend first a proper consultation with your family doctor or general physician or an ophthalmologist or ENT specialist.
So when should someone seek medical help? Like if I'm getting headache for once or twice, I may feel like it will go off. Like maybe something is happening right now, so because of that I'm getting it will go off. And sometimes it goes on also. So I don't feel it in the future, so I'm okay. But sometimes people like in the beginning they think ki, like I'm getting this for some time, but at the end they keep on like getting more as time passes. So when is the like best time or good time for them to like go and seek medical help?
Aha. For this, I will explain
Yeah.
in brief about the head. In the sense, what is skull made of?
Sure, sir.
Okay, so I can exhibit on a prop. I can exhibit on a prop. So you know, it's easy to understand. Yeah.
Sure, sir.
So if you take human face, okay, so it is comprised of external skull. Then there are structures over the skull, structures inside the skull.
Okay.
Okay, so what you're seeing is eyes,
Yeah.
then eyebrows,
Yeah.
then red color thing and blue color thing.
Huh.
These are called sinus cavities.
Okay.
Okay, this is the nose. Okay, nose, then adjacent to nose, above the nose, we have sinus cavities.
Okay.
Okay.
So all the blue ones and the red ones are the sinus cavities.
Sinus cavity,
Okay, sir.
exactly. Now, above the red one,
Huh.
we'll have brain. So inside the skull, there is brain.
Huh.
So why I'm telling you is causes of headache. One, it's easy to understand to know the what subject is suffering from. So I'll just go very briefly about the structures.
Sure, sir.
So causes of headache, I told you migraine, tension headaches, then cluster headaches. So migraine is the single-sided headache. Okay. So those are the three types. So if we go structure-wise, most commonest structure which causes headache is the nose.
Okay.
Then sinuses. These are called sinus headaches
Okay.
or headaches related to nose.
So when we get fever or something, like we started like getting headache, even if it like without any fever also, like थोड़ा ठंडा लगा है, like थोड़ा cold ऐसा, that time also we start like getting headache. I have seen people who are like normally sneezing or coughing, they are also getting headache,
Yeah.
like because of it. So is it also related to the sinus only?
Exactly, exactly. So the subject or individual coming to you with episode of cold and headache, meaning what? There is a blockage in the nose, there is decreased ventilation to the sinuses, there is no oxygen to the sinuses.
Okay.
That's when they get vacuum headaches or headache in the head, headache in the frontal, I mean to say this
The
region or
part,
this region,
forehead part.
forehead
Yeah.
or this region between the eyebrows. These are all sinus related headaches. Okay.
Okay, sir.
Then headaches related to vision. Vision. Suppose an individual is having refractory changes, meaning they have some sight. It can be a near sight or far sighted. So these conditions also can give severe headache. So one should differentiate whether it is due to nose, is it due to orbit, is it due to brain.
Okay.
Okay. So, and most importantly, teeth also can give headaches.
Yeah.
Okay. A person having a decayed tooth, meaning the tooth is not healthy, what we call decayed tooth. Okay, tooth decay.
Yes, sir.
Yeah. So most of them, they go for root canal treatment. Okay. So they come to us with headaches. So there is nothing in the nose, nothing in the orbit. So we have to check their teeth also. Then fourth important, joint. See, opening and closing mouth, that can give headaches. Why? These muscles, they go into what we call spasm. Okay. This can give complete one-sided headache. So diagnosis is very important. It's not just writing, one ibuprofen with paracetamol. No. It should be properly examined, get a diagnosis, if needed, get investigated. Are you getting me?
Yes,
Is
sir.
it easy to understand?
Yes, sir. Like a scan. Like
Yeah.
at first we have to, like, instead of directly going to the store, ki, like, give me some medicines, I'm having this, that, this, because they are not doctors. They doesn't know everything. They
Exactly.
knows normal things like
Yeah.
us ki, acha theek hai, fever hai, let's go and buy paracetamol, like that. So once we go to the doctor, like, they can examine us better,
Yeah.
and after examine only we'll know ki what is the main source and main thing that is like
Cause.
causing us the pain
Problem.
in the head.
Yeah. So I think this has given you some overview
Yes, sir.
what the subject would be suffering, and most important, apart from sinus, apart from orbit,
Yeah.
apart from teeth, apart from muscles and joints, we should consider the brain also. Okay.
Okay.
So if even after giving certain medication, subject is not getting relief, better get a neurophysician consultation,
Okay.
brain specialist. If needed, get a MRI or CT scan. Is there any mass or tumor in the brain
Okay.
which is giving headaches?
Like, which is not like directly visible without scan and without proper examination.
Yeah. Their condition, apart from headache, they may have vomiting,
Okay.
they may have reeling sensation, giddiness. Sometimes there is a chance of bouts of unconsciousness,
Like blackouts.
blackouts.
Okay.
So we should not degrade the situation or disrespect their complaint.
Okay.
We should consider the complaint, better recommend them to a neurophysician or a neurosurgeon.
But for that also, first we have to go to a doctor and like stop going to the normal general like stores for medicines.
Exactly.
Like getting a doctor visit is the must.
Yes.
In these cases.
Yes.
As you have already told us in the beginning, like without medicine also we can like cure the headaches a little bit, like normal headaches, by getting like doing something which is giving us peace, or like if lightning is a problem, then like thoda stay away from sunlight,
Yeah.
or like loud music and all. So are there like any more like therapies or exercises like which can be helpful, like if someone is like doesn't want to go to the doctor?
Oh yeah.
Yeah.
Now, you were telling me about the lifestyle of
Yes.
this era, where people are working for 14 hours,
Yes.
then 16 hours, sleeping only for 5 hours, so which is totally imbalance. You know balance, right?
Yes, sir.
Balance. It has center 1 and 2 at the edges. So life is like that: work, food, and sleep. Three aspects. There has to be balance for work, food, and sleep. So you are working more, less sleep, there is an imbalance, right?
So like in today's generation, like in our life, the word called balance has like left us long back. Whenever I go for like job interviews and all, they're normally asking, okay, you have to work here for 11 hours. I'm like, really? Then when am I supposed to like go home? Like if I'm staying alone in Hyderabad, so I have to like manage everything. Like if I want to eat, I have to cook, because everyday outside food is again a big no.
No way.
Like
It's
maybe once a month is okay. Like if you're feeling okay, today I don't want to do anything. Today is a relaxed day, or maybe once a week, that is okay. But every day it is not possible. We have to cook. To cook also, we don't have time. If we cook, then when we will sleep, when we will get up, like get ready and again travel and go to office. And in this traffic jam and all, we have to leave minimum 1 hour early.
correct, correct. So here comes spiritual part of life. Okay. No, this is a serious business.
Yeah.
What you are asking me and what I have to tell,
Huh.
it is a serious matter as such. Because what you are asking me is very practical. Morning 8 o'clock, we start from home, reach office 9 o'clock, then reach home by 11 o'clock. Yeah, for a single individual without a support, it is quite difficult. They have to prepare for their week on Sundays, the entire program. Okay, apart from that, to tackle the headache, there are certain aspects like deep breathing techniques.
Yeah.
Deep breathing techniques, they will harmonize the fluids. See, I spoke to you about the structure of a
Yes, sir.
face, wherein I told you about the skull,
Like the
brain,
blockage.
brain, then vessels, the nerves. Apart from that, there are fluids in the body. So hydration is most important. One has to drink a lot of water. Second, deep breathing techniques. Number three, meditation helps you in getting rid of excess sleep. Suppose you don't have time and you go into deep meditation of 15-20 minutes under proper guidance, okay, it is equal to 1 hour sleep.
Okay.
That will restore, rejuvenate your energy.
Like it's almost similar to like giving the brain a little rest also, because when you like deep breathing also comes under meditation thoda.
Yes.
So if you're like
Beyond that is your meditative skills.
like as we do like blocking one nose and then breathe from the one, and we also get to know if like there is some blockage or something, like by doing that we find out.
Yeah. So that is apart from medication.
Huh.
So that we can recommend to people who are ready to listen. Not everybody will listen to this part.
For
Okay?
2 or 3 days maximum.
Exactly. That's what I told you. One has to prepare a disciplinary chart and follow it. Like the way you are going to office, you are taking bath, you're brushing your teeth, you're eating. Same time, meditation should be the part of your routine.
Yeah.
Yes.
Like it shouldn't have to be like just early in the morning, like whenever you get time, but you have to do it.
Yes.
Like the way you know that you have to eat at the end of the day, you have to do that also, so that you don't end up being like in a clinic or with a doctor and all.
Correct. Correct.